Hello guys, I'm Dr. Arshad Nadeem Awan with my ultrasound teaching video, and today the video which I'm showing you, that is particularly acute appendicitis and acute appendicitis sequels as well. Sometime you will straight away see acute appendicitis. The patient will be in a pain, in agony with the right iliac fossa pain with increased leukocytosis and some other findings on the x-rays, abdomen, sentinel loop, and many more. But today I'm just looking for, and I'm showing you the video of the acute appendicitis. Sometimes acute appendicitis gives rise to cause the abscess formation, periappendicular abscess, and some other stranding of the muscles and stranding of the fats around the appendiceal region. So you can all pick that on ultrasound imaging. So this video is particularly selected to show you the acute appendicitis and the acute appendicitis sequel. So let's watch this video.
This is the example of acute appendicitis. Here on this ultrasound image you can appreciate this well defined. Here you can see this is a non-compressible bowel loop, and this is what appendicitis will look like. Here you can see like this is quite clearly visible, and if you come across with these you should label this as an acute appendicitis. The another point associated with this is that you can see this echogenic fat. So whenever the fat is inflamed, this is called as fat stranding. So look at this in a transverse view. You can see clearly visible appendix but associated with fat stranding. This is the clear example of the acute appendicitis, and it will appear on the ultrasound imaging the way you are appreciating it right now. Mind you that you should always survey the surrounding areas as well for the enlarged lymph node and any other collections. Here this surrounding area is also visible, where you can see the fat strandings or surrounding tissue stranding. Here if you focus on, so this is a particularly bowel loop. You can see the bowel loop is there, but if you come out of this bowel loop, you will appreciate that on the top of it in a longitudinal way, in a longitudinal fashion, you can see that this is what the surrounding small areas of collection is visible. So this is what the appendix. Here you can see very clearly visible appendix associated with surrounding fat strandings. In surrounding inflamed area is also visible. So in fact this is what complex acute appendicitis associated with some surrounding inflammatory phlegmon, and which I have already shown you in the previous slide on the previous images. Only focus on this particular area and just go along with the or follow this blunt loop. So this would be blunt loop, this would be non-compressible, this would be aperistalsis, and beside this you should have to focus on the surrounding areas like fat strandings, and if there is any fluid in the surrounding area, or if there is any collection associated with. So for this view is concerned, here you can see that this is a non-compressible aperistaltic bowel loop, and its wall is echogenic because of the inflammatory changes. While reporting the acute appendicitis, I must mention its diameter, like to what extent it has gone increased, or beside this you should also mention that this is aperistalsis. You should also mention this is a blunt bowel loop. Here you can see the fat strandings, if there is any fluid around, or if there is any collection around. So this information should be on your report, and then at the end you can mention that this ultrasound finding is or ultrasound findings are consistent with acute appendicitis. Surgical team referral is recommended, and correlation with the clinical laboratory reporting is suggested.